welcome all, everyone again. We can hear Dr. Sanghani. She can hear me and I can hear her. Uh, the topic for this evening is tackling diabetes in senior citizens with lesser medicine. And I'm delighted to have here with us Dr. Sanghani, who is a US-based, US board certified endocrinologist and has over 15 years of clinical experience. She uses education, motivation, and empowerment to help her patients make lifestyle changes, and which often results in lesser medication while achieving better overall health. Welcome to Health Live, Dr. Sangani. How have you been?
I've been great. Thank you, Pradyuman, for having me. I know we tried to do this earlier and you were persistent, and I'm glad to be here.
Persistent and perseverance always pays, right?
Always pays, always pays.
And I'm sure it also pays in this battle against diabetes.
Definitely, yes.
Over to you, Dr. Sangani, for a few words about what the topic is, and I'm sure there are hajar questions which are from our readers and viewers who are present here, and I will start taking them. Over to you first.
Sure, thank you so much. And I did go through some of the questions you sent me that you got as an early round of questions, and I was very excited to see the type of questions that came up. So if it's okay, can I share my screen?
Yes, please go ahead.
Okay.
Yeah, you can.
All right, great. Visible?
Yes, absolutely. The Asan way, very nice.
So that's the name of our practice. And the word asan comes from two things, of course, easy, as well as the word asan also means teacher from the word acharya.
Right.
So, and also the word doctor in Latin means teacher. Because long back when doctors started to be doctors, they didn't have too many medicines. They could only teach people how to change the lifestyle. And somewhere along the way, we got into a lot of medication. So today I wanted to talk to you about going back to the basics of how to look at diabetes from a way of reducing medication. And my background, as Pradyuman said, is I'm an endocrinologist, which I should explain to you what that even means. It's a tongue twister for many people. So I am a medical doctor. I completed my MBBS from KEM in 2001, 20 years ago. I then went on to the US and I did my MD internal medicine, which is 3 years of internal medicine, MD medicine. Then I spent a year as a teacher for MD medicine candidates. And that was fantastic to be teaching such amazing, intelligent doctors. I then went on to super specialize. So after MD medicine, you could do cardiology, nephrology, oncology, endocrinology. So endocrinology is the super specialization after medicine, which involves all the hormones. And diabetes comes under that because the hormone involved in diabetes is insulin. So I'm a super specialist in hormones, which means diabetes, thyroid, insulin resistance, blood pressure, obesity, weight management, slowing metabolism, menopause. All of that actually comes under the hormones. I practiced in the US in private practice for a couple of years and then came back to India to be closer to family 10 years ago. And I was at Mahim Hinduja for about 4.5 years full time. And then 2016 is when I decided to start on my own. I was with Breach Candy for a while. And now my practice is entirely outpatient, which means my job is to literally work with you all to keep you out of hospital. The learning never stops, even if your official degree collecting can stop. So I became a diabetes educator in 2011 to teach people lifestyle change for diabetes. I got certified in mindful eating, which is all about cravings, emotional eating, stress eating, social eating, overeating, dieting, all that. Emotional freedom technique, because I'm sure as this audience knows, stress itself can raise the blood sugar. Getting caught up in negative emotions can raise the blood sugar. It's all hormonal. At the end of the day, if I carry stress, my hormones get affected, my stress hormones. I was very interested in exercise and personal fitness for my own sake. And then when I realized the power of lifestyle change in diabetes, I wanted to be more qualified to discuss exercise with my patients. So I became a personal trainer. And I think spirituality was a big turning point in my life. I was going through a personally rough patch, and spirituality was my only way out of a really dark place in my head. And Reiki, and from there, many things to understand that it's not doctor patient, it's person. So when I talk to somebody with diabetes, it's not that the doctor is going to tell the patient what to do, especially if I'm trying to reduce prescriptions. I have to work with you to understand where your expertise about your life, your preferences comes into the picture, and my expertise about diabetes. So we are both equals, we are both experts. And that spiritual approach helps me really find joy in connecting at a deeper level than just pushing medicines down somebody's life, right? And the learning never stops. So we love to keep reading books and stay up to date. So, what is diabetes? Everybody thinks about diabetes as a high blood sugar problem. And yes, it is diagnosed as a high blood sugar problem. All right. And many of you may know this either directly or through somebody in your life who has diabetes. And maybe this was your experience that you get diagnosed, you start on one drug, the drugs go up, and after keep going back to the doctor, it starts to become multiple drug combinations, and then finally the picture starts to look like you're avoiding the mangoes, you're avoiding the sweets, you've stopped eating sugar, and still your diabetes is progressing. And then now they're beginning to talk about putting you on insulin. All the while you might be still gaining weight even though you're following some sort of diabetic diet. And one of the questions that came was, why do we crave sweet? And one of the reasons that you will crave sweet is because of the treatments that we give you, which is we prescribe drugs to push the high sugar down, but we push it down so hard. We doctors' prescriptions are so strong sometimes that you get a low sugar. And diabetes was high sugar. We made it a problem of low sugar, and then you have to keep eating to keep your sugar high. So it's really it's a situation where a patient can get stuck. And my role is, I see, is to help you break out of this sort of upward spiral where eventually they're talking about just getting on insulin. So it is an insulin problem first. Diabetes, before it becomes a blood sugar problem, is an insulin problem. The same way malaria is not a problem of fever. Fever is a symptom of malaria, but malaria is an infection by a malarial parasite because a mosquito bit you. Dengue is as a viral infection because a mosquito with dengue parasite bit you. Tuberculosis, fever, all of them have fever, but the cause of the fever is different. So in diabetes, the cause of the high blood sugar can be two different kinds. There is two different types of insulin problem. So what is insulin? Insulin is the hormone that regulates your blood sugar. Insulin plays many roles in the body. My specialty, endocrinology, is the highest level of medical training there is in the subject of insulin. So an insulin expert is the endocrinologist, okay? And so I'm fully qualified to prescribe it. And yet there are two kinds of patients. One is somebody whose body is not making insulin. Type 1 diabetes, juvenile diabetes, insulin dependent diabetes. This child will not survive without insulin. This was almost 100 years ago. She was disappearing, losing weight, no matter what her parents fed. She was just disappearing in front of their eyes because her body was not making insulin. So check if when you got the diagnosis of diabetes, was your body going through something like this? Were you becoming skin and bones, losing weight, just disappearing? And then with getting the insulin treatment, they saved her life. So this was before the insulin treatment. They did her investigations. Of course, back then, 100 years back, they didn't have blood tests for insulin. They were checking the urine. The urine was sweet. They found the pancreas of certain animals when, given in a injection form into this girl was life-saving for her, okay? So through a lot of trial and error, the discovery of insulin was made, and this girl's life was saved almost 100 years ago. Some of you may have found out about diabetes this way, not like the girl who became so skinny, skin and bones, but an expanding stomach, not a shrinking stomach, expanding stomach, weight gain on the paunch, growing inches around the waist. That's type 2 diabetes. This type of diabetes does not require insulin as a treatment. Okay, how will you know whether you need insulin as the treatment or not. How will you know if your pancreas is working or not? This blood test at the top, fasting C-peptide, and you can do, if you're not being given insulin injections, then you can do an insulin test. If you're taking insulin injections, do not do the insulin test. Okay, then only do the fasting C-peptide test. That will tell us whether we should be treating you with insulin or not. Because if your pancreas has not failed, the treatment should not be insulin. If you're making insulin, I should not give you insulin. I should give you lifestyle change. So, what are the lifestyle changes that we work on, which have been impressively powerful with our patients? How do we get them to less medicine and less insulin? I could spend 1 hour on this. I know time is limited and I want to take questions, but in brief, nutrition, going low on carbohydrates, sleep, stress, exercise. One of the questions from the audience was, do we have to stop sugar completely? And the answer is, I've seen people stop sugar ever since they found out about diabetes, but they keep all the other carbohydrates in their life and their diabetes never gets cured. So when the chai comes, they'll say, nahi, 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 mujhe sugar hai, diabetes hai, to give me fika chai. But then they'll have 3 chapatis. They'll have poha for breakfast. They'll have biscuits with chai. So they're still taking carbohydrates, but they think I've stopped sugar or I've stopped mango. But the diabetes never got cured because they're still taking hidden carbohydrates, which they don't even realize. They might be all ghar ka khana, home food, but if you're still eating carbohydrates, it's not going to go away. All right. Sleep management, stress management, exercise, and then intermittent fasting in certain patients has helped to reverse diabetes and get them to less medication. Okay. So the way I describe it is, if you're going to take a car on the highway, Bombay to Goa, on a long drive, you need to first get the car checked in the garage for a tune up. 4 wheels have to be correct, even one puncture and you cannot drive. Doesn't matter if the other 3 wheels are correct. You need all four wheels in proper condition. Nutrition, sleep, stress, exercise. After that, you can talk about intermittent fasting. We do it with medication management as well, because being a medical doctor, I need to manage your medication to make it safe for you to fast. Because you may think, somebody with diabetes, how can they fast? They have to eat every 2 hours. Why should they eat every 2 hours? If you met someone like us and we prescribed you such heavy medicines that your sugar is now going to drop, only then you have to keep eating. Remember, if the diagnosis of diabetes was coming with a growing waistline, increasing weight, how can the solution be to make you keep eating? And then we tell you that you should lose weight in diabetes. How will you lose weight if you keep eating? I've not seen anybody who's able to do that for the rest of their life. Okay. And managing stress through spirituality. And one of my patients gave me an analogy. She said, Doc, you know what you've taught me? You've taught me to drive my own car, nutrition, sleep, stress, exercise, fasting. And you've also taught me that the fuel for this car, the petrol or diesel for this car, is self-love and self-care. And I thought that was beautiful. And that's exactly right. We don't want to make you run this on fear. Fear is not a way to sustain changes for the rest of your life. If I have a smoker and I keep saying you'll get cancer, you'll get cancer, that doesn't work. Making somebody scared does not work to quit smoking. Why will they quit? When they decide that they love themselves enough. Why will someone make the changes in lifestyle for diabetes or for any hormone management that for the rest of their life if the fuel is self-care and self-love? So this came to me from a patient. She said, maybe you can draw a little petrol tank over there and the fuel tank and show that the fuel for this whole process is self-care and self-love. And it's an honor for us to be able to do that. All right. So this is the structure of how it all plays together. This obviously takes more than 10 minutes to explain, but I'll just show you how complicated the hormones are and how much overlap is there between all the different things. If you see the questions that you put in the chat to Pradyuman before we got together, you mentioned things like sugar cravings. All this stuff plays together. All of this is linked through hormones. All these arrows, which I've shown in an oversimplified way, these are all hormone connections between all the different parts of the body, all the different systems. And it's actually state of the art. This is the American Diabetes Association guidelines 2021. And I know that this audience of yours, Pradyuman, is a very well-read, up-to-date audience. So I like to also keep you guys up to date that in medical nutrition therapy, in fine print, it is written very clearly that going low carb or very low carb helps reduce diabetes medication. It's just that people don't tell you this. And people don't know what are the Indian carbohydrates. We live in a country where vegetarianism is very common. Even people who say they are non-veg, are eating small pieces of non-veg maybe twice a week, but they're not eating it every day. So they're also practically eating all the time veg, which is fine. I don't have a problem. I'm veg myself, but if they're going heavy on the carbohydrates, they're getting stuck. So what we have as goals for you or for anybody who works with us is how to get your sugar under control, HbA1c, sugar levels, no low sugar problems. Everything should be stable. Less medicine for sugar, triglyceride, cholesterol. De-prescribe insulin if it's type 2. How will you know? Check the fasting C-peptide. Less insulin dose, even if it's type 1. Inch loss from the waist. Body fat percent down. Reverse fatty liver. Reduce cardiac risk. Improve the immunity in COVID times. We must mention, we all know that diabetes plays a role, obesity plays a role in COVID outcomes. And so our people for the past 1 year have been working very hard on investing in their immunity. They've been reversing all kinds of stuff in the past 1 year. And touch wood, all of our patients, whoever got COVID also, have all come home. Okay. And that's God's grace. And we hope to continue to work in that direction. These people are feeling energy levels going up, mood going up, positivity going up. They don't feel stuck in some diet, ki mera wo chhoot gaya, my favorite food is gone, none of that. And so many allied symptoms, body pain, shoulder pain, acidity, headache, insomnia, everything getting better with less medication. So I just want to leave you with the fact that type 2 diabetes can be reversed. Think of it as not just a blood sugar problem, think of it as an insulin problem. If there's one thing you can remember today, think about it, that if you make lifestyle changes to reduce insulin resistance, that's your way out. Okay. So whatever treatment is given to you, check whether that is reducing insulin resistance or keeping you stuck in insulin resistance. If you're eating every 2 hours, you will not get out of insulin resistance. There's no way. Okay. You can help to reduce things at the root, and I can take questions now. Thank you.
Great. Thank you very much, Dr. Sanghani. This was a quick fire presentation, and I wish you could have gone on and on and on.
Oh,
because I think it made a lot of sense to a host of our people who were listening in and sending me messages that it's been an amazing presentation. So, those of you who have questions can send in your questions on the Q&A tab, and I'll be happy to take them. Let me come to you with a question from someone who has emailed it to us. He says, hi doctor, I'm 63, a diabetic from Pune. My diabetes is under control with medication. The doctor has asked me to stop sugar completely. What are the alternative options for sugar? I know sweeteners are chemicals, but what do you suggest? And I might ask another question over here, which is a little more specific. Is it all right to have stuff like sugar-free, and is Diet Coke really harmful?
How many minutes are you going to give me?
You come from the land of Diet Coke, so you of various diet drinks, so you would know better.
I know. So how many minutes do I have to answer that question, right? We get this question every day. And before I start encouraging or suggesting sugar substitutes, what I ask my patients is, why do they feel the need for the sweet taste? Let's ask a more basic question. If you understand that you are eating the sweet for taste, you can decide how much. But if I say, instead of this sweetener, have that sweetener, we've not addressed the fact that you are feeling stuck with the need to keep putting sweet in your mouth. And there is no health benefit in any of these sweeteners. Okay, so I don't answer. It's like saying that, can I quit smoking, but can I start chewing tobacco? There is no benefit in a sweetener. Now, if you talk about Diet Coke, if you talk about non-caloric sweeteners, the evidence is beginning to come that even diet sodas are linked with weight gain, because people somewhere make a switch in their head that I cut out my calories by taking a Diet Coke, so I've allowed myself some other calories somewhere else. So diet sodas have not been shown to help weight loss. Plus the fact that the sweet flavor in the mouth tends to set you up for more cravings. You're still craving something again at the end. You want something again in a few hours. You get an energy hit from the caffeine and a crash. Also, the effect of non-caloric sweeteners, sugar substitutes on the gut bacteria, the gut microbiome, that the bacterial population in the intestine is another brain. It's considered to be a second brain besides the brain up here, that there is an entire system of bacteria and the neurons in our stomach which talk to each other. And there is a possibility that these non-caloric sweeteners coming in interact with the stomach in a way that creates more cravings, and you don't get satisfaction from the meal. So if you look at people who are asking more about the diet sodas, they might be the ones who are struggling with a lot of cravings. So we want to go to the root of the cravings rather than trying to make switches here and there, replace this with replace that.
What about this entire, it's not just in India, but even elsewhere in the world, about this kuch meetha ho jaye. Right?
Once in a while, everything is okay. Once in a while, everything is okay. We're having it for pleasure. So what we teach our patients is, let's learn to balance our eating for pleasure as well as health. So in that, sweets come, sugar comes, mango comes, fruit comes, knowing that these are all sweet, these are being taken for pleasure. So how do I balance that for health? I think everybody understands that too much of a good thing or too much of a bad thing in extreme can be an issue. So the idea is to learn how to create a life of balance. Why? Because that keeps it sustainable. If I say no sugar, stop completely, how many people have been able to hear that advice and adhere to it like a robot? We're not robots. We have needs, we have emotions, we have cravings. So I don't like giving advice that I cannot follow myself. I like to have a sweet once in a while, but I have learned how to balance it. I used to eat sugar every day, morning, afternoon, night. I had pre-diabetes and I've come out. My Gujarati family tree is very full of diabetes, right? So I think it's about learning how to balance rather than feeling powerless. Some people say, don't put sugar in front of me. Once I see it, I can't stop. Again, I think we are giving a lot of power to a thing that sits on a shelf in a jar, and letting go of the power that we have within ourselves. So it's a lot of coaching, it's a lot of mindset work to help us build a healthier relationship with our food as well as with our bodies.
Right. So the little bit of amras puri is all right in the mango season, is it?
Yes, why not? In moderation, of course. I've never seen anybody who left mango and got cured of diabetes. So might as well learn how to keep the fruits or keep the sweets that you love, but learn how to balance it out. And sometimes we focus heavily on nutrition, missing out on sleep, stress, exercise, and fasting. So if you keep pinching someone with diabetes on their food choices without giving them all the other comprehensive three other wheels of the car, it gets frustrating in the house. People are chasing the patient, saying patient is not listening, patient is not cooperating, patient is feeling like my family is pouncing on me. All this big drama happening over food. Whereas if we learn to hold ourselves accountable, I'm sure people will find the way out. And that's what we see, is once that wisdom clicks in, they learn the balance.
Right. Thank you. We have a question from Sushil Kumar, since we spoke about sugar substitutes, is how about stevia as a sugar substitute?
Yeah, I covered that in my answer. Is that's another sweetener. People will say stevia is natural, so it should be fine, but sugar is also natural. Sugar comes from a plant. It's just been processed the heck out of it. Stevia, you're not going and biting the leaves of a stevia plant in your house from a pot. The stevia powder is extremely processed. So long-term effects on gut bacteria are not known, and it still keeps you hooked for the need for sweet taste on your tongue. So for me, it's not a sustainable way. I'm going to take one question here, which says exercise and no carbs looks ridiculous. I would agree with you. And that's why nothing is being prescribed in extreme. I think it helps for a person to know that they always have choice, that they have nutrition, sleep, stress, exercise to create a balanced approach. I wouldn't be able to do no carbs. So I completely agree with you. It's what's the point of giving ridiculous advice to each other? Let's give more realistic advice, right?
Right, absolutely.
Yeah.
The number of questions that are coming in around diets is just endless. But there are a few specific questions which I will ask you about.
Yeah.
One is from Mr. Sanjay Bhatia, who's 61. He says his diabetes is at the 200 and above 100 for the last 15 years. He does eat medicines. He has no issues. He's okay. He eats all, including sweets. I'm always on exercise daily. Yet at times I feel weak, and then I take some sweet. I'm doing okay. Should there be a change?
Again, we need to review your medication. That if you're feeling weak and it gets better with sweet, are you on some prescription from your doctor that makes your sugar crash low? Because those are the medicines that I don't write. So it's hard to comment without reviewing your prescriptions. But let's assume that you are not on something that's causing a low sugar and you're still feeling low energy. There are many causes of low energy. Again, not getting enough protein, not getting enough salt, not getting enough water, not getting enough rest, magnesium, okay, chronic stress, chronic thoughts, lack of exercise. You said you exercise. So there is a whole checklist that we go through when you hear about low energy.
Uh, Doc, we have a couple of questions, and I'm going to combine them about
Sure.
Ayurvedic therapies and homeopathic therapies.
Right.
How much are these trustable, dependable, and can one look at as options to the allopathic way of treatment?
Yeah. I mean, we are in India. There is a very large population that believes in Ayurveda and homeopathy. So I'm not about to sit and cancel entire fields of scientific approach. So I think we need to know about the purity of the substances that you are taking from Ayurveda and homeopathy. And I don't have a problem. If it's working for you, then please keep it. What I have seen sometimes is when people take unknown herbal powders and things like that, where the ingredients are unknown, they've come in with toxicities. I've had somebody come in with kidney damage. So there was some insulin mimicking plant, which was given as a diabetes treatment, a natural thing, roots and berries and barks and things that they had to boil and keep in the house and have a kada of it. And the sugar came down, but the kidney got affected. And when we stopped all these things, we sent this. I was working at Hinduja at the time, and I got the lab to analyze it. They could see insulin activity in this plant, but the kidney got affected. So I will support. Let's do things with least amount of medication. And one of your audience had sent an early question saying, isn't it something like a scam that the sugar targets keep getting reduced to support the pharma companies pushing more drugs? Well, if you suspect that, then I would invite you to invest in lifestyle change where nobody makes money off of you. You keep your money with yourself. Nutrition, sleep, stress, exercise, and fasting cost you nothing. Nobody makes money from it, and you will be able to reverse your diabetes and keep your, pocket money to yourself. So if there is that belief that somebody's just trying to scam me and make me take more medicine, there are other ways. Just check your fasting C-peptide test and go full on into lifestyle change. You don't need to worry about someone cheating you then, because your body will do it for you, right?
That's a very nice and direct message, right? And not very easy to achieve.
Which one is not easy?
About making the lifestyle changes that you recommended. It's not as easy as it sounds.
No, you're right. And that's what we have taken interest as our full-time job. Our specialty is to coach people through step-by-step lifestyle change. So I will not sit here and tell you, go fix your nutrition, sleep, stress, exercise. Actually, if I'm trying to work with someone without prescribing heavy, only prescription heavy practice, I actually need to take the role of a coach. And that's what we do, is we literally get into a coaching relationship, a student-teacher relationship. How do you fix your nutrition? How do you fix your sleep, stress, exercise? How do we get you to intermittent fasting? That's where the effort is, to realize your habits, because only then your diabetes is going to get less with less medicine, is by changing habits.
Right. We have a question from Aditya Kumar, who says, I'm 69 and a type 2 diabetic for the past 30 years. Presently, I'm taking 40 units of Homology 50 mixed insulin, Jalra 50 by 1000,
Yep.
Crevest 10 mg for sugar, and other tablets like EcoSprin 75, Ellen Block 10 mg, etc. My HB1AC is 8.0 and a creatinine is 2.0. Do you have any serious physical concerns? Medically, what is my health status? Am I healthy or need attention on any specific parameter? My normal SpO2 is 85 to 90.
Oh, yes. Again, it's not fair to make a diagnosis in public, but somebody who's taking 40 units of insulin and the HbA1c is still 8, means that whatever strongest treatment the doctor seems to have, which is insulin, even after giving you 40 units of the last resort treatment, your sugars are still not in control. Okay. And I would ask you that, have you been gaining weight after starting those 40 units? Probably yes. The creatinine of 2 means the kidney is already getting affected. So I would want to turn this around aggressively. And I've just put in the Zoom chat something called fasting C peptide. Please get that checked and talk to your doctor. If your C peptide shows that your body is making insulin, ask them, why do they have you on insulin? They may say, well, but your lifestyle is such that your sugar is high and my job is to prescribe you medicines. Okay, so what about the lifestyle change? What if the patient knew that if I make lifestyle change, I can avoid insulin? Does the patient know that? So you can have that conversation with your doctor with that fasting C peptide report.
Right. Thank you. We have a question from Devendra Gada, who asks, why does the body shrink in a diabetic patient?
Shrink.
Yeah.
Yeah, we do see more muscle loss in people with type 2 diabetes. The higher the sugar, the more the muscle loss. And in India, for some reason, everybody's very confirmed with the idea that we should start walking. The minute we have diabetes, people are willing to start walking. But the blocks about muscle building exercise, strength training exercise in India, our culture has not yet widely adopted it. And there is some block there. So the shrinking that you see is oftentimes muscle loss, and they still have a paunch. So they might look very slim on the arms and legs, but they have a paunch. That is a classic insulin resistance type of situation that needs to be broken down. Again, protein may not be getting in sufficient quantity. Even people from good homes or from underprivileged homes not getting enough protein, and they'll see muscle losses and shrinking of the muscle. So we need to fix it through nutrition and exercise.
Thanks. We have a question from Mahavir Hazare, who says, taking continuous medicines of diabetes and blood pressure, do they have side effects in future?
Of course, all medicines come with side effects.
He is 66, and with sugar and BP, things are under control. Does exercise every day. Can we reduce tablets and everything if everything is under control?
Well, if I'm the doctor, that's what I want to do. Okay, I'm not going to comment on somebody else's practice, treatment style. You have to work with the doctor you're working with. It's not professional to comment on somebody else's approach with your health. I don't know your case particularly, but if it's somebody working with me and we've had a good discussion that, look, I want to reduce your medicine, patient wants to reduce medicine, let's look how to optimize the nutrition, sleep, stress, exercise, fasting, so that it's safe and medically responsible to reduce the medicine and keep observing the blood sugar, the blood pressure.
Thank you. We have a question from MC Raju, who asks, I'm a diabetic since 28 years, type 2, the ranges mentioned as 70 to 100, 70 to 110 and 140. Is this applicable uniformly to all?
Yes. We want your fasting sugar to be less than 100. We want your post-meal sugar to be less than 140, ideally without medication, least amount of medication. And something here which you have asked in the next is insulin required unless it's above 250? I don't think we're looking at that question properly. This is like saying that if the fever goes to 102, then we should give Crocin. But we're not asking the right question. The right question to ask is, why are you getting a fever? Why is your sugar high? If I know why your sugar is high, then I will know whether insulin is the right treatment or insulin is the wrong treatment. If your sugar is high because insulin production in your body has failed, then we need to give you insulin. If your sugar is high because your lifestyle is such that your pancreas is trying with insulin, but it's not able to cope up with your lifestyle, insulin is the wrong treatment. The treatment has to be lifestyle change. So it's a very partial question. We need to ask a more precise question, is why is the sugar 250, and go after the cause. Insulin is a very simple thing. If I give you insulin, your sugar will go down. But if it's given in the wrong context, it will make you gain weight and it will make insulin resistance worse. Always remember, ask from the context of insulin resistance, not just blood sugar. I said it in the beginning for those of you who came late. Diabetes is not just a problem of blood sugar. Blood sugar is the symptom like a fever. You can't just push a fever down without knowing the cause. You shouldn't just push a sugar down without knowing the cause. So figure out, why is the sugar high? Because of insulin deficiency or insulin resistance. It's completely two different treatment tracks.
Right. Doctor, there's a question that has come in, and he wants to ask, at what stage does one come to someone like you for treatment? Is it after controlling diabetes and ensuring the sugar levels are under control, or is it right from the beginning?
I see people at all spectrum. I see people who have nothing wrong with them, who want to get on a track because their kids are gaining weight and they want to set a right example. So they come in as adults. I have people on pre-diabetes getting into the borderline, realizing that if China and Pakistan are on the border, the Indian army responds. You don't just say border pe hai chalega. You take care of your border. So if diabetes is at the border, I don't know where complacency should come. If it's on the border, you push it. If it's a cockroach on your window, you're not going to say it's on the border. So why diabetes on the border, we take it lax. So pre-diabetes people who want to take it seriously, we work. Early diagnosis of diabetes, late diagnosis, 20 years, severely uncontrolled diabetes. We see the whole spectrum. But the common point is the right person to work with us is the one who wants to work on lifestyle change so that they can reduce the burden of prescriptions and insulin. If they say, doc, you're telling all these things, it's ridiculous. I cannot do these nutrition, sleep, stress, exercise changes. You just give me the medicine. I will say, just change the doctor. That's okay. God bless you. I will not participate in just prescribing more medicine when I can see that it is a lifestyle issue. Because for me, that feels personally as an ethical practice, it feels corrupt.
Very well said. There's a question from Shashikant Lag. Is this coaching possible online?
Yeah, we've been working online since March 14, 2020. I actually gave away the keys to my clinic last July because the pandemic affects people with diabetes and hypertension the most. My staff was traveling by train. I could not mix people with diabetes with my traveling, commuting staff by train. I said, we will go online till this pandemic and vaccination is under control. And we've been fully 100% online since last March, almost 15 months now, working more than before, I would say, because people want this. People want to take their lifestyle in their hand, and it's been amazing. The amount of work people have done in this 1 year of pandemic to take their health back has been amazing.
Great, thank you. We have a question from June Gama, who asks, is diabetes hereditary within the family?
It can be genetically passed on, yes, but like I said, I'm born into a Gujarati family where the tree is full of diabetes. You shake the tree on both sides and diabetes will come falling down from the branches of
That's a
the
very
tree.
mean thing to say.
What thing?
That's a very mean thing to say about your family.
My family, there's diabetes on both sides. I have lost relatives to it, including grandparents, aunts, uncles on both sides. So I say it from front line, okay, knowing how much of a killer this disease is. And yes, to be talking respectfully of it, the genetic tendency in my Gujarati family is very strong. I touched pre-diabetes and came out. Okay. So, but what I'm trying to say is I have a say in the matter. You also inherit lifestyle. When you live in a family, you not just get the DNA, you also get the food patterns, you also get the exercise patterns, you get the late night sleeping patterns, you get the stress management patterns, you get the nutrition, sleep, stress, exercise habits from family, from growing up. So not only DNA, but habits. So maybe I can't do anything about DNA. Maybe I can if you believe in epigenetics. That's a different conversation. But you have a say in your habits. So I don't settle down with it's hereditary, so it's going to happen to me because then I'll be included in that. I'll be in that tree of my family when it comes to diabetes. Right now, my HbA1c is 4.8. It has touched pre-diabetes. When I have eaten cakes and sugary things, my sugar has crossed 200. So I know I have a tendency. If I give away my lifestyle, I will be someone with diabetes very soon.
Very well said. We have a question from Malcolm Montero, who says, kindly guide me on the specifics of intermittent fasting. What is the frequency recommended once a week? There's a similar question by Devendra Gada.
Yeah, that's a good question, my dear. I would need to answer that in a very, catered context, in the sense, like I showed you the picture of the car. that for me, intermittent fasting is the thing you put on the carrier of your car. Once you have fixed all the four wheels of the car, nutrition, sleep, stress, exercise, then we say the car is well tuned up and ready for fasting. So you need to have the right amount of protein in your diet. We need to have reduced your carbohydrates, include the healthy fats so you're not feeling hungry all day long, feeling like munching. If you're hungry all day long, how will you fast? So we need to correct the nutrition there. I need to correct the medication over there, diabetes medication that might be unsafe to fast. Okay, there are certain diabetes prescriptions which makes it unsafe to fast. I need to clean that up. Sleep, stress, exercise. Then fasting. The starting fasting can be 12 hours, 14 hours, 16. How many times a week depends on each body. If it's somebody with brand new diagnosis of diabetes, maybe 16 hours alternate day works for them. If it's someone with longer diabetes, again, their body will give us the feedback. So there is no one prescription of fasting that I give a person. We literally, that's what takes us so many phone calls, so much coaching to individually take a guess, not a guess, to take a feedback from their body, how it responds with X number of hours of fasting. And the solution is extremely individualized. So there's no one perfect answer. 16/8 is the starting point, alternate days, as a very basic start of fasting. Once nutrition, sleep, stress, exercise, and medication is sorted.
Thank you. We have a question from Ram Malkani, who asks, any test for sugar levels without pricking the finger for blood, like the oximeter?
There is the Abbott sensor. There is a continuous glucose monitoring chip that you can wear on the arm. It's a product by Abbott, which comes with a reader, and you flash the reader over your arm and you get patterns. It's not exactly the same in terms of accuracy as a drop of blood, but it is sort of going to show you patterns. It's going to show you trends, like the stock market line. It shows you trends and patterns.
We have a question from Shashikant Lad. I think your website you had mentioned, but he wants, he requests for details for an online connect.
I have something, a blurb on WhatsApp. Should I put it in the Zoom chat box?
Yes, you could do that.
Okay, okay, I'll do that. Yeah.
And so there are a few questions which are, one is diet related. So if you can give a, I know not one diet fits all, but the point is some general tips on do's and don'ts. What role does spirituality play in diabetes, and what kind of yoga exercises can one do?
Oh, those are good questions. I wish I had all day to talk to you guys, because there is really a lot to say about each of these. Let me post this detail here. Let's see if it pastes it. Paste. Oh, it's not letting me paste. Why is that? Let's try again. So the first question you said, can you, I think there were multiple questions there. Can you repeat the first part? Diet, right?
Yeah, so one is diet. What kind of diet would you recommend, some do's and don'ts?
Yeah, so I would say there is no do and don't. The minute I say do and don't, the human being on the other side is going to react and rebel that, but I have these reasons why I'm doing this. So I don't start with telling you what to do. I start with, tell me what you're doing now. Let me understand your habits now, and we'll make 19-20 changes in your existing habits to start slowly turning the direction. Because if you're here, and if I suddenly put you on a diet that's here, do this, don't do this, but you were this, it's going to be too drastic and not sustainable. That's not how you change habits. Habits don't change overnight because they didn't form overnight. You form those habits over years. So to change those habits doesn't have to take years. We'll take weeks and months maybe, but we'll do something like this. Can you reduce your carbohydrates a little? So if you're taking 2 chapatis, can you take 1 chapati? In place of that 1 chapati, can you take more dal and can you take more sabji? The same dal, chapati, sabji, which was being made in your kitchen for years, same menu, same cook, just your portion of carbohydrate being reduced, your portion of protein and vegetables being increased to target. That would be the simplest form of advice. And your sweets, which you want to have, you decide how much to have, knowing it is a carbohydrate. Somebody's been asking about fruits and some other doctors' advice on fruits. Fruits comes under carbohydrates. So you decide how much of carbohydrates you want, whether it is a roti or a fruit or a meatha. Okay, you decide. All of those are going to come in the carbohydrate bucket, which means insulin secretion. Remember, I'm coming at you. All my answers are coming from insulin resistance, not dieting and not only blood sugar, because I'm treating blood sugar at the root. Okay, so that's the most powerful thing, is to reduce carbohydrates and increase proteins to target. I'm not able to paste my thing. Maybe
Worries, no worries. You could just say it, and then when we do carry the takeaways on Monday, we will carry it.
okay.
That so you can just tell us, and people would take it down.
Yeah. Let me see. I don't know what the block is. I'm going to try pasting a smaller thing and see if that works. Yeah, this worked. There is a link I put.
That's
That
right.
is the best way to get in touch with us. Um, and I will send you a blurb, Pradyuman, about how to reach us and things like that. But this link is to a form which helps you contact us, and we can reach out to you.
Doc, the number of questions that are coming in, some of which you can see, some of which you can't,
I can see a lot
is
of
just
things.
endless. And I think I'm going to request you to come to us once again and take another session.
Yeah.
But yeah, so one was, the question was on diet, the other was on
Spirituality and yoga.
Spirituality and yoga.
I'm
How
gonna
much of a role can spirituality
Oh,
take?
big time. Spirituality is probably the backbone of my practice. For me, spirituality doesn't mean which God you pray to or whether you even believe in God. Even if you say there is no God, that's fine. For me, the divine or the almighty or whatever ultimate thing sees to it that Jupiter and Saturn don't crash into each other. Okay. And that the sun rises every day around 6:30 in the morning. Whoever is in charge of that. I don't know who put that in place. Okay. That is pumping inside you and me both. That for me is spirituality. Self care and self love exists in us. And for me to help you reverse your diabetes, we need to wake that thing up. When I tell you changes in nutrition, no, but my family doesn't understand. No, but my situation is like this. There is a self care block. If I say exercise, no, but there is so much stress around me that I can't take out time for myself. I always put myself last. No time. That's a self care block. Sleep management, either you're up because of anxiety, or you're taking all your thoughts into the bed, or you're working for your employer, burning the candle at both ends. That's a self care block. Okay. So everything boils down, whenever a suggestion which will help you comes and your answer is no, there is a self-care block. Now I can coach you with expertise. I have the expertise of how to reverse diabetes, but you have the expertise about you and your life. So wherever you as an expert in taking care of you is struggling in self-care, that's where we want to help you plug in more spirituality, giving you that confidence, making small changes. So there's a lot of behavior science in it. So I've studied a lot about behavior science, behavioral economics, how marketing gurus get us to buy their brand of toothpaste, but I can't get you to buy my brand of lifestyle change. Why do we not know how to do that? We know how to prescribe you drugs, and marketing is left to somebody else. Okay, why not market good ideas to you, right? So that is a spirituality. That is a form of spirituality. We're not selling something bad, we're selling something good. We're helping you take your health back in your hands. So for me, you taking your health back in your hand is a very high life purpose, very spiritual. And when you see it wake up in a person, when you see a person say, I managed in the middle of this pandemic, everybody around me was sick, I was taking care of them, but I also managed my diabetes. Compared to 3 years back when hell happened, my diabetes went for a toss because all my self-care went out the window. For that person to come around and say, I managed my life in the middle of stress, because life is always going to throw googlies and stress. So in the middle of that, to learn how to take care of yourself consistently, day in, day out. See, we all have bad days. Okay. There are days when I don't want to wake up. I want to just laze around in the bed. We all have that. But how do we pull ourselves back out of from there is spirituality for me. So I want to leave you guys with that. फिर तो yoga में ये आसन अच्छा है, वो आसन अच्छा है. That's not the only part. Of course, there is good yoga for it, but that's like, there are so many things I can tell you. I can go on and on in nutrition, sleep, stress, exercise, right? So spirituality is the backbone of it all. Agar fasting karna hai, I say fasting, nahi, I to need to eat, I have cravings, I cannot trust myself. That's spirituality issue. You don't trust yourself, right? You can eat that food when the fast ends. So the decision has to be from inside. Why will you fast? I can't force you to fast. It has to be a decision from you. That's spirituality. And we like to wake that up with you. And what we do is we create that space of love. So when normally when you come to a doctor, the doctor is scolding you, na, you're not listening. Family is also saying patient's not listening. So anyway, the self-esteem is low. Scolding ही मिलने वाला है. So we don't want that. So we don't scold. We help you feel safe, non-judgmental, loving environment. Only if I create that environment of love and acceptance, you all will feel like stepping forward. We're not here to judge, right? I think that's the most important responsibility that we bring is you bring that change. If I want you to practice self-love, I have to practice self-love. And then you reflect that out, and then you create a ripple, and then you unleash it. And then you tell one, and then they tell 10, and then self-love, self-care goes around. It's amazing.
Absolutely. And that's how we heard about you. And, I've heard some amazing stories about your treatment. So thanks very much, Dr. Sangani, for spending all this time. I've already got messages that, we must have you here again. So I'm going to come up once again in a few weeks to get you on board and perhaps look at a sharper topic that we can discuss on other than what we
maybe a more precise topic, because sometimes the openness of it, you're not giving a focused information, and that's fine. It's an icebreaker, but each of these is like books and hours and hours of things that we can discuss in a fun way.
Great. Thank you very much once again, Dr. Roshani Sanghani, for spending time with us at Health Live at Seniors Today. We are going to be back once again next week. And next week we have Dr. Roopkur Sahani, who's going to be talking about dementia and other neurological issues concerning senior citizens. So please be there. And once again, thank you very much.
Thank you.